Now, the first one is what I call hyperconsumerism. And hyperconsumerism is very important. And when I think about hyperconsumerism, I'm not just talking about patients, I'm also talking about employees and partners and other stakeholders. Because everyone that we serve, from our stakeholders, employees, to our customers, have been hyperconsumerized. And what that means is they have really good options. And if we aren't their best option, then our organization and our department or our enterprise is at great risk. We have to make sure that we realize that today there are unemployed people and there are talented people, but there are no unemployed talented people. Many healthcare clinics in the United States today are operating at 80% staffing level. They will never be able to attract and keep the best talent unless they look at their internal stakeholder as a consumer. And when we understand hyperconsumerism, we realize that we also can't massively improve our HCAHPS scores at the hospital and clinic level unless we realize that a good patient experience can only be delivered by really happy employees. Also in my consulting practice, we won't even take on a client that isn't willing to call their patient a consumer. Because patients wait for an hour, consumers don't wait for an hour. And when you look at the competitive models that are happening today, hospitals and clinics will not be competing against the clinic down the street. They'll be competing with CVS, with Walmart, with all kinds of new, really interesting clinical models that are coming from technology companies that are creating really beautiful, elegant, thoughtful experiences to customers or patients in a way that really, really impacts their desire to go to that clinical option. In other words, we need to be the best option for employees and we need to be the best option for patients. The only way you do that is through a thoughtful HX, human experience strategy, that addresses consumerism and employees at the same time. Now, consumerism is also important to understand because the baseline level of patient expectation, consumer expectation, in other words, the bar, it's always rising. And so every year, consumers expect more value and less friction. And yet we have the most friction-laden industry of any industry in the world. Healthcare is very poorly thought out in general in terms of the way in which it delivers human experiences. But if we can commit to better human experiences, we can increase efficiencies. We can significantly improve our patient satisfaction and our HCAHPS scores. We can significantly improve the way in which we gain insights on ways to be able to deliver better clinical value and even safe and efficacious clinical care. So everything that we want to do from a patient care perspective lives within consumerism. Because at the end of the day, we need to understand our consumers far better so that we can deliver thoughtful and unique innovations that go above their baseline level of expectation. So in simple terms, this first pillar, consumerism, is one of the secret tools that the best organizations in healthcare are using to drive sustainable growth, profitability, improved presenteeism, improved stakeholder attraction and retention. Now, the thing is that we have to go way beyond this concept of PX. I hear a lot of people talking about patient experience. There's even programs that train people in patient experience. I really think we need to go beyond improving on a really bad system. And that is one of the biggest mistakes when it comes to consumerism. We tend to try to improve on something that's really bad, rather than destroying what we have done historically and creating beautiful new clinical models. Now, this doesn't just apply to hospitals and clinics. It applies to medical device companies, insurance companies. It applies to life science organizations, pharmaceuticals. Anybody that lives within the healthcare ecosystem needs to be far more thoughtful and more contemporaneous in the nature of the types of things they design to really create something that is way above what we have done historically. chaotic innovation mandates it. Let me say that again. Chaotic innovation mandates that we become customer experience and human experience experts, and it mandates that we develop formal strategies around these areas if we want to meet our organizational goals. Again, the good news is you can increase efficiencies, you can reduce costs, you can improve employee presenteeism, you can increase your returns on human capital, you can attract great talent, and most importantly, you can serve that core, beautiful, thoughtful mission of delivering safe and quality care to patients. I mean, that's why we're all in this in the first place. So the first pillar, hyperconsumerism. And the reason I'm spending so much time on it, it is so ignored by most organizations. In fact, there was a study that was done by Bain Corporation that interviewed over 300 executives. And they asked them a very simple question. They asked them, do you deliver great experiences? And did you know that almost 80% of them said, absolutely, our experiences that we deliver to our consumers are amazing. Then they decided, well, wow, that's impressive. Let's see what your customers have to say about this. So they interviewed the customers of those companies, and only 7% agreed with the proclamation of the CEO that they delivered exceptional customer experience. The problem? Delusion. We tend to be delusional about the way in which we're delivering care because oftentimes we really aren't in the front lines to where we're seeing how patient-facing stakeholders are serving those patients. And sadly, we're oftentimes not serving that caregiver. You know, we have these people that show up every day to serve our really, really big mission of delivering safe and efficacious quality care in an equitable and fair way. And yet we forget the burdens and the challenges that they have, and the stress and burnout today for patient-facing stakeholders, or healthcare stakeholders in general, is at an all-time high. And that's why I believe when we think about this first pillar of consumerism, we need to look at our employees as a consumer, and we need to look at our patients as a consumer. And again, maybe even use some bigger language when we're describing those patients, like consumer. The second pillar is this big pillar of enabling technology and connection architecture. One of the things I've learned from operating my own AI lab and serving as a chief innovation officer for a major medical company is that we found that, at the end of the day, if something can be connected in healthcare, it can be connected, it will be connected. And when it's connected, it will deliver far more value to healthcare. So connection architecture is the connection of all things, the continuous connection and monitoring of patients. We will see the extinction of wrist-based, watch-type wearable devices to new in-ear devices that will monitor blood pressure. It'll monitor EEG data, core body temperature, movement. It will listen to the voice using voice AI to determine mood state and even lucidity. We have such incredible new technologies coming out, and I believe, stay tuned, that the real major wearable technology will be in-ear technologies, not wearable technologies. And there's so many reasons for that, not least of which is the fact that we can get really, really good data inside the ear. But we also can have two-way, full duplex dialogue with the patient if it's in their ear. We can help the patient throughout the day make better choices or let them know gently by mentioning in their ear conditions to give them real-time feedback. They, of course, will be able to control all these functions, but they'll be able to be diagnosed 24 hours a day, and ultimately through anticipatory healthcare using AI and multiple continuous monitoring, we'll be able to dispatch patients to care based on what the black box is seeing through wearable devices. Now, for some people, they see this as Orwellian, but the truth of the matter is that it's going to save a lot of lives. And I believe that in 5 to 8 years, if you want health insurance, you will have to agree to being monitored, much like teenagers that want car insurance have to have their cars monitored using the accelerometer in their cell phone, or even in some cases, a plug-in device to monitor their speed and behavior. Again, I'm not advocating anything. I'm just suggesting that we will absolutely use in-ear technologies and continuous wearable technologies as a way to be able to reduce healthcare costs and improve the way in which we manage chronic disease and other disease processes. It's inevitable. But there are many other really exciting new technologies that are going to make everyone's life better. But again, as a leader and as a CEO, or a manager, if you don't understand these technologies, it's really impossible for you to champion them. I find in my consulting practice, some of the top CEOs in the world have made a commitment to understanding these trends and applying actionable strategies to make certain that their strategy squares up with the future of healthcare. The last pillar of chaotic change is new economic and value models. We're really going to change the transference of wealth, right? Where money is made and where money is going to become far more of a retail model than our current institutional approach of healthcare. We're going to see patients really doing some very practical things and very practical decisions to circumvent hospitals and clinics because the experience is more relevant and the experience is more valuable. So those are the three big pillars of chaotic change. We've got hyperconsumerization, which includes your employees. We have the impact of connection architecture and emerging technologies. And then lastly, we have new economic models and new patient value models that are really going to change everything.